reason patients need root canals done is because some way, somehow, some bacteria has infected the inside of the tooth. There is a chamber where the nerve sits in the middle of the tooth that has a canal that runs out the tip of the root. There is a nerve with a small blood supply that runs inside the tip of the root, up through that canal, and fills up that chamber. That portion of tooth, the chamber and that canal, is sterile. There's no bacteria in there, and we don't want any in there. If it gets in there, that's an infection. There's multiple ways bacteria can get in there. One of the most common is a large cavity, very deep cavity that reaches where that chamber is in the center of the tooth. A cavity is bacteria. So if that bacteria makes it all the way there, jumps inside that canal, that chamber, that is an infection, and we have to help you with that. We can't leave bacteria or leave an infection in your tooth and try to treat it otherwise. The root canal procedure is what does that. We expose that chamber of the tooth, where that nerve is and where that bacteria is. We physically clean out the canal itself and that chamber, disinfect it, and seal it up. That way, if any bacteria has made it through the tooth and out the root tip where that small hole is, that's what we call an abscess. The body can heal that following the root canal once it's disinfected and sealed up. Even though the tooth has become infected, with that root canal procedure, that can be a very viable tooth over time for you, and it can last a long, long time following that treatment.